Welcome to the ID16.9 Podcast, where we try to delve into the details of and realities surrounding United Nations Sustainable Development Goal 16.9 for legal identity for all, including birth registration, by 2030. Because more than 1 billion people in the world have no legal identity, and 2030 is fast approaching. I'm your producer and host, Frank Hersey. In this episode, we're heading to Zimbabwe to hear about the impact that a lack of ID has on individuals and the country as a whole. Our guest works at the community level and will take us through all the issues and how they play out differently in rural and urban Zimbabwe. And she's got some solutions.
Joining me now is Tafadzwa Mavudzi, a monitoring and evaluation specialist for the NGO Nutrition Action Zimbabwe. Thank you so much for joining us.
Thank you, Frank. It's a pleasure having you here. Thank you very much for inviting me for the interview.
So I thought, really, let's just hear a little bit about what you do in your role. What's a typical day, if there is such a thing as a typical day in your job?
So my job, I work for the Nutrition Action Zimbabwe as an M&E specialist, monitoring and evaluation specialist. I work with different communities, trying to see how best we can report their impact, how we are doing well to the vulnerable communities in the rural areas. So most of the time we are working with those vulnerable people, interviewing them, trying to understand how our projects that we are implementing to them to try and uplift their livelihoods, how we can actually change them and how we are actually changing their lives. So it's usually my typical day of life, like just getting to understand how our project is impacting on those communities.
And what sorts of issues do you come across? What sorts of health issues do you come across?
So we have different health issues that we're coming up with, especially when you note that Zimbabwe is in the sub-Saharan Africa. So sub-Saharan Africa, we've got lots of health delivery issues. So we can start with, basically, in my typical work, we have issues to do with malnutrition. If you look at the malnutrition rates in Zimbabwe, we're still facing undernutrition in Zimbabwe. We still have children that are undernourished with standing. And you see that most of our areas that we are working in their standing rates are usually below the global threshold range of 20%. Mm-hmm. So we try to work capacitating the communities so that they at least understand what a healthy diet is, trying to promote a healthy diet using their local available foods. And also have the issues to do with HIV/AIDS is still prevalent, and we still find the issues people which are still affected by HIV/AIDS. So we try to work with those communities as well in trying to just build awareness about testing, being tested, and seeking health attention from the hospitals. And sometimes one of the issues that is the main issue that we are failing to get to address these issues as early as possible is issues to do with coordination. We don't really have like an information system sometimes that's where we can get information as early as possible so that we help people as early as possible. They lack awareness, so they need to be having instant information, receiving instant information.
What about things like record keeping? Do you have files? The people who you work with, is it a patient relationship, or are you just going into communities with more general help?
We are just going into the communities with more general health, but we usually work with the ministry, the government ministries. So wherever the work that we are doing, we coordinate with the government ministries, such as that from the district to the village levels. So you find that they have their volunteers at that community level that usually have information around issues to do with information around the health. Information is there. Our structures, especially in Zimbabwe, everything is there. It's well structured. But I think the main challenge is that we have usually at that low level, we've got what are called the village health workers. Mm-hmm. So the village health workers are the ones that have got information, but their information is usually paper-based. Mm-hmm. So they take the information, they take it to the clinic, and usually they go to the clinic once a week. once a month to the clinic to give their reports, what are the issues in the communities. So sometimes that's the challenging if we've got a paper-based system. Even the government has tried to put some like using phones as a way of passing information to the health clinics, and then the health clinics can pass it to the district. But the major challenge has been some of the areas in the rural areas, they don't have network. So sometimes it's very difficult for them to trickle the information to the health delivery system.
What about the issue of identity? Do people have problems accessing services if they don't have a certain type of identity document?
So, as for the health delivery system, I don't think they really have problems in accessing help, but there are other things that are linked to health that also affect people that don't have an identity document. Because you find that we have a magnitude of people. There was a survey that was done actually in Matebeleland South, I think it was in 2018, which actually showed that more than 30% of children in Matebeleland North, they did not have identity documents. So one thing that happens if I was a child, if I didn't have an identity documents, it means also my children will not be able to access. Because when my child wants to access an identity document, they need my ID to get the access documents. So what it means is that those people without identity, it's difficult for them to access school. So it also contributes to the literacy level, because some of the health problems that we are facing is that people, they don't have like in-depth understanding of the health problems that they have, even prevention, even curing those diseases, because they don't have much knowledge. So it also contributes to them not understanding the magnitude of the problems that they have. So it means if I don't have an identity document, like most of the people we have been meeting who don't have identity documents, it's actually difficult for them to get identity documents for their children. So their children will not go to school. If they don't go to school, it means it's affecting their literacy level. If it's affecting their literacy level, it means even in everything that they want to access, economy, you cannot go to work. Even if you don't have money, you can't even get work, formal job for you to go if you don't have an identity document. So it means if you want to go and access healthcare, you can't, because sometimes you need to pay money. Most of the things are not free. So if you need to pay money and you don't have income with you, it also affects you as a person, and you cannot access health delivery system. So that has been the most biggest challenge that we've been finding with people that don't have identity documents, and they cannot access any other. It's difficult for them to access any other services within their communities, even if you want them to get somewhere. Because I was also working, there was also an organization that I was working with, women's rights advocacy. We find that it was even difficult for them to, even if they want to get into leadership position, if they want to be a councillor, you need to have an identity. If you want to be an MP, you need to have an identity document. So if you don't have, you can't have all those things that are within your communities. But for now, they can access the clinic, but you can only access free medical care. But if you want to pay, you can't. So that has been one of the major challenges we have been facing with people that don't have identity document. Even for their school children, they can't write exams. They can learn maybe until grade 6, but when they get up to grade 7, when they want to write the final primary, what we call the primary examination or elementary school examinations, they can't, because they don't have the IDs. So what they normally do is they'll end up at grade 6, and they'll have all those things that affect them.
So the issue is they can go to school, they can go in the building, into the classroom, and the teachers will teach them without ID,
Yeah.
but they can't then progress. They can't prove who they are to do an exam to then carry on in school.
Yes, they can't. But in some schools, in rural areas, sometimes because it's a community, they allow the school children to come to school. But in some schools, if one person even goes to grade 1, they'll ask for their identity. If you don't have a birth certificate, they'll tell you that you can't attend school. You need your birth certificate to prove your age. Even if you go to school, you cannot even access some of the things, because even if you want to play sports, let's say a child is talented in sports, they will ask for your birth certificate. And if you don't have a birth certificate, it's easy to prove your age. So you'll not be able to participate in sport at that high level, competitive level. So they are already disadvantaged in terms of even everything that they want to do. So that's the other challenge. And also the other challenge that we've faced, we've also been facing people like who are like younger children who are raped or were sexually abused or sexually exploited. And according to the international guideline, the UNCRC, any person who's below the age of 18 years, they're children.
Yes.
So sometimes if they are sexually abused, it's actually difficult for them to prove their age if they don't have birth certificate. We have had instances like that where a child has been sexually abused. The case is reported to the police, the case goes to the court, but now it's hard for us to prove that the child is below the age of 18. And they would require the DNA, and sometimes the DNA is difficult to access the DNA because of funding and everything. So it's actually some of those health issues that are also affecting children without identity documents.
So it feels like it's not necessarily the most immediate impact of not having ID, especially for areas like health. It feels like it's affecting society much more generally. And do you think that's something that people are aware of in Zimbabwe, the people you work with? Do you think people are aware that identity or not having a birth certificate is holding people back, and I suppose even holding society and the economy back?
Yes, it's something that has been known because ever since the other survey that has been shared, now people, they are aware that it's actually impacting a large number of children. Because initially, most people, it was not something, people were aware that not having a documentation, it affects someone, but they didn't know the impact, how it was affecting the population at large in Zimbabwe. But you now find that it is become a tropical issue in the country to say, no, we need to ensure that all the children are having the documentation, they have the birth certificate. And they've been doing some blitz whereby they go into the communities and trying to make sure that every child is getting a birth certificate or even an identity document for those people that do not have the identity document. Because one of the challenging things that makes people don't have an identity document is that accessibility, because most our systems are centralized. So if it means if I'm staying in a rural area, I need to go to a major town or a major city to get my birth certificate or to get my ID. So if I don't get where it's needed, if I don't have a bank account, if I don't want to open a bank account, I will not need an ID. If I'm not finding a job, I'll not need an ID. So I'll not find it as it's important to get IDs. So those are some of the findings of the research that was done. The government and other partners have been trying to get into the communities to try and assist people to get identities. But still, there are other challenges and limiting factors that are affecting those people. For example, if the mother doesn't have a birth certificate or the father doesn't have a certificate, an identity document, an ID, the child can't get a birth certificate. So this has been the major factor, and it's actually, and people are aware that yes, if you don't have an identity document, you can't access anything. But it's difficult, and there are some who've got the ignorance. Like we have also been capacitating in another organization that I was working with. Also, we're capacitating mothers. There are some single mothers that are there. They would say, I'm waiting for the father so that I'll be able to get the birth certificate for the child. So they'll be waiting for the father, and the father is nowhere to be found. And the child is now already 9-10 years old, and the child doesn't have a birth certificate. So we're trying to make them aware and the importance of that child having a birth certificate, and trying to assist them to actually ensure that their children are getting their birth certificate within wherever they can go, so that the child is having a birth certificate. And also there are other families. I still remember assisting this couple. The mother was married, but she divorced from the father, but she used their maiden surname to give to the child. And the child got married to a woman. So they said, no, I need to first change my name so that I get my original surname, so that I'm able to get my children's birth certificates. And then after talking to them and making them aware that it's important for these children to get their birth certificate, and it's their fundamental right for them to have their birth certificate, to have their identity, to have names that they identified with. And then they actually found that it was actually true, and they had to go and source identity document for the children. So some people are aware, but they don't really see the actually consequences that not having an identity document brings into their life. As long as they are not looking for a job, as long as they are doing their own thing. Because as you know, in Zimbabwe, most people are now doing their income generating project. So if they're doing their income generating project, they don't need a passport, they don't need to open a bank account, they've got their pillow account. They don't see the importance of having an identity document.
Because they're working for cash.
Yes, they're working for cash.
Yeah, I can see why you could maybe go so to a certain extent in life thinking that you don't need it, and then one day something's going to happen though. Maybe you do want to get married or get divorced or something, and then how would an adult try to get an ID document? Would they have to first get a birth certificate before they can get anything else?
Yes, you need to have a birth certificate before you can get anything else. So that's what you need to do. So our system, what it does, which has been a major challenging thing, is if you are old, it becomes difficult and more difficult for you to get a birth certificate. Because I remember there was a lady who were trying to assist in getting an ID. She didn't have a birth certificate. Her parents were dead. And the way they died, they also didn't have any identity documents. It was difficult because at least if they had identity, they could have just taken the death certificate and actually get a birth certificate and also get an ID. So they were told to go back to the community, to the school where she used to go, and that headmaster has to write a letter, and the chief to say that they know that person and it's her name, she was born on this day, and also come with someone from your family who can confirm that you are part of this family. So it becomes very difficult now because you now need resources to go back and try, and it can also be a back and forth thing. So one of the things that people have been advocating for is this process has to be made easier for people to get birth certificate, and also if it could be given at birth, a birth certificate, if it can be decentralized, the system, to say the moment I deliver my child in a clinic or in a hospital, I can just get my identity document right there and there, rather than for me to have to go to a centralized place to get a birth certificate, or even the IDs, they have to be decentralized in such a way that I just have to walk maybe 5 kilometers or less to get my identity document. It would make things easier. And maybe continued awareness of the people, the importance of having identity documents. It would also help in terms of reducing number of people that do not have identity documents.
I just want to go back to something you said there about death certificates. Does that mean that, say, there's a family with a few generations without birth certificates, without ID? If perhaps you're an adult and your elderly parent dies, is there a process there where can they get a death certificate without themselves having had a birth certificate?
They don't get the death certificate. It's actually very difficult for them to get a death certificate if they didn't have actually an identity document, because it has to be shown from the records that this person was existing, and they cancel that record and they produce a death certificate. So it's actually very difficult. And in the rural areas, someone can even be buried without even no one knowing if someone was buried, because they'll just dig their grave and they bury someone, and there's no like a tracking system to say all the graveyards that are in the country are the deaths recorded or not. So it can actually happen that it can be actually a generation of people that have been going on and on and on without birth certificate. And usually it becomes a cycle, because if I don't have an identity document, there's a high possibility that my child also doesn't have an identity document. And it goes on and on and on and on and like that.
And if your parent died and a death certificate was produced, could you use that death certificate as part of your own way to get your own identity?
Yes, you can use that death certificate to get your own identity, but there's also need to be proof to say those are your parents, because anyone can use anyone's death certificate to say, yes, that was my father. So they have to have a proof. So it's actually, maybe you can use your uncle who's got the same surname with your parents to actually confirm that, yes, this is our child, this was my brother's child. Or you can have maybe a letter, if you're from the rural areas, you can have a letter from the sub or the chief to confirm that, yes, we know that this is Tafadzwa. She's the daughter of so and so who died on that, who's got this death certificate. So that's the process that usually happens. But you can actually get a birth certificate using a death certificate, as long as there's the proof that those are your parents.
So it sounds like local chiefs have quite a pivotal role. They're very important people. I was wondering, you must meet them every now and again, well, maybe quite frequently in your work. I was wondering, how do they learn about all these things? They seem to have to deal with so many different situations and deal with bureaucracy. I was wondering, what sorts of training do they get?
Unfortunately, they don't get any trainings. It's something that they have to learn while doing their work. Because one of the important thing why they understand these issues, because they stay within the community. And the way our rural areas are structured in Zimbabwe is that it becomes like it's a one community. When you're in your community, it becomes like one community. So some of the issues that will be happening within their communities, they easily know them, that there's this issue that is happening in this community. But what I really get you is that sometimes, since they have these important roles, they need to be having different trainings that they are supported, so that sometimes they have the expertise and they have the capacity to deal with different issues that they meet on day-to-day basis. But currently, they don't really get so much trainings. But what we normally do as implementing partners, international and local, whenever we are having programs that we are coming with, we also try to sensitize them, also try to involve them in the trainings that we are having, so that they have a little bit, they have an understanding of the things that we are doing in those communities. So sometimes that's the capacity sometimes that they get in those communities that they are.
And I suppose one of the issues is that if these village chiefs are producing letters to vouch for people, how can somebody know that this letter is actually from a village chief? Would that need to be a personal relationship with the village chief? Need to know the person who works in the nearest civil registry for dealing with birth certificates, etc.? Like, how would they trust that something is from a chief?
I think there's a gap there, because there was maybe that's why they need different information from different areas, because you also need to get a letter from the chief. Also need to get a letter from, maybe if you went to school, they also need the letter from the school, and maybe they would also need a confirmation if your parents are dead. They also need a confirmation from maybe one of the relatives that has got an identity document, so that they're able to triangulate all those things so that they confirm it's true. But in every system, I think there's always flaws, and maybe sometimes some people can try to hit around the system and cheat the system, I know. But I think that's why they try to triangulate the information, so that they are certain that you are claiming who you are claiming to be. But some people, they've actually done it a differently way. Like, for example, if I didn't have an ID and my father didn't have an ID, I would use my uncle's ID or my grandfather's ID. I remember there's some people who actually had their grandfathers as their dates on their birth certificate, so that they could just be able to get an identity document. So there are people who are actually going to that extent. Or my uncle, my dad's brother, I can just go and claim that he's my dad and have a birth certificate, then everything is over. So people can do whatever they can to actually get. There are some people who are going to that extent to get an identity document.
So you could end up with somebody who's 40 and they have a document as somebody who's 75.
Yes, that's very true. I know someone who had the dad was around. It was a grandfather. The dad was around when she was 21. The dad was like 72. So that was her grandfather. But on literally that was her dad. But because her dad had actually passed away without getting a birth certificate for her, But the grandfather knew the importance of having a birth certificate, so she just said, "Let's go get a birth certificate for you." And they went together with the grandmother. So the grandmother was the mother, and the granddad was the father. Yeah.
Just because it's the only way they could do it. I was just thinking there about the resource that village chiefs are, or local chiefs are. Is there a difference then in towns and cities where I don't know whether there's an equivalent network of more urban local representatives? And is it in some ways better to be in the countryside where you have this relationship with somebody who's respected and can vouch for you? Are there any advantages there to actually being in a village rather than being in a city trying to get ID?
So what I can say is that there is that seesaw kind of thing between the urban and the rural. Because in the rural, when you actually don't have anyone, it's actually easy because you know the chief, you know this your village yet, the school that you learn with, maybe you learned at, they still remember you, they still know you. So it's actually maybe very easy to get some of those documents. Then in the urban areas, sometimes it's actually very difficult. It's a system that most people they don't know each other. You just live in the city and you go. But one of the advantages with the city is that most people were in the city because it's schools in the cities they're usually stricter when you're coming to school. They usually want to see the birth certificate before you can even start your grade one. So sometimes you're forced to actually have a birth certificate for your child because your child has to go to school. So sometimes it actually forces you. So if you don't have anyone, one thing about the urban setup is it's easy for them because they can actually just try to find someone within the same surname who can assist. And one of the things that needs it is the birth record. Sometimes when the child is still, I think, below the age of 5, they need a birth record. So it's easier. You can just go to the clinic because the clinic it's easier, and the clinics and the hospitals, the network is easier. You can easily get transport to go to the clinic to the next area, and most of the transport is usually less than $1 to get a transport to go to the clinic. And most of the clinics you can just walk, depending on where you were delivered, where the baby was delivered. So sometimes it's actually very easy to ensure that you get a birth record as long as you've got a card, a baby health card. You can just go and say, I delivered here, I need a birth record. They'll just look into their records and give you a birth record. And then you can just go and get a birth certificate for your child. If there's no one and you can't get your birth record, you can just get someone who will assist you to get a birth certificate. That's how people have been cheating the system. So it's easier. I find it's a seesaw kind of a relationship between the urban and the rural.
So you said you need to find somebody with the same surname. So that doesn't necessarily have to be a real relative. It could just be a neighbor, someone living nearby who has the same surname who can try to help you.
Yeah, but it's not just anybody because usually in Zimbabwe, if you have most of people that have a surname will be having a relationship, and it's not fit. It's actually very difficult to just go to a person and say, "I need you to help me with the birth certificate." It's usually has to be someone who you know, who you trust, who is your relative, who is closer to you, and who really understands your problem. Like yes, but it's usually easier in the urban areas to get a birth certificate as long as you've got your birth record for your child. As a woman, you've got your birth certificate, you've got your national identity document, can easily go to the registry and get the birth certificate for your child. It's usually an easy process, but because if people like the challenges that I alluded to earlier to say, some people are just ignorant. They say, I will wait for the father to come so that I get the birth certificate for the child. So if the child gets older, the older the child gets, the more difficult it is for you to just get birth certificate easily. But if the child is below 5 years, it's very easy. You go to the clinic, you get the birth record, you go to the registry with your ID, you get the birth certificate of your child. But because of that challenge in the urban area, that some people are just, I'll wait for my husband to come back and then I can get, it's just an awareness issue. Then when you come to the other people that are there in the community, that are there in the urban areas, one of the things that I've seen with people that are in the urban areas is to do it, especially if I don't have a birth certificate. It's difficult for me to get a birth certificate for my child. That's when we have a challenge. That's when some people cheat the system. If they feel that it's important for my child to get birth certificate, I don't want them to be like what I was. That's when they will use their relatives to say, can you assist me in getting an identity document for my child, and they get identity document for their children. They cheat the system. But yeah, they're in the urban areas that don't even have the birth certificate, that are staying there. And there's a magnitude of people that don't have documentation, and they are adults. Their children also don't have birth certificates.
If it carries on generation after generation, what's going to have to change? Is civil society trying to push for legal changes to change the whole system so people can get an ID document as an adult, even though they missed out on a birth certificate earlier in life?
Yeah, I think the legal system need to be changed. One, a child, because I believe if a child, the government has to force people to get children to get birth certificate. If parents cannot get a birth certificate for their children, government have to do something so that at least they have, I don't know what they can call it. It can be called a pseudo birth certificate or whatever, so that a child at least have an identity document. Because and also even for the adults, they need to find a way that they can do to ensure that everyone who's identified not to be having a documentation should have a documentation. And it should also be an easy process that if I go into to get my identity document, I don't need to be required with a lot of things that I need. There has to be a simplified system, just like if I want to change my name to say I no longer want to be identified with Tafadzwa, to be called Tafadzwa, I should just go into the registry and say now I need to be known as a Meander or something, and things are easily changed, and I get my documentation. Because and if you look at those people, most of them that don't have documentation, it's not even their fault. And if you listen to their stories, they are always the sad ones, because the most vulnerable ones are the most people that don't have documentation. That's the sad thing. And usually, if you look at them, they are orphans, the people that maybe have been looked after by other relatives, and they've not even tried to find birth certificate for those people. So that people tend to grow old, and then when they grow older, they get married. When they get married, they don't have IDs. And then what do you do? Nothing. You can't get a birth certificate for your child because you don't have a birth certificate. So if there are people with those situations, there should be a system which makes everything easy. As long as someone can prove that I'm an orphan, I don't have anyone, they should be given a birth certificate, an identity document, and they have an identity document. Also, I feel the system should be decentralized, because the moment it has, I have to go maybe more than 30, 40 kilometers, and I have to fork out my money to go and get an identity document. I will not. As long as there's nothing that is pushing me to get that identity document, I will not get the identity document. So that's what the government should try and do, to decentralize the system.
Do you see any signs of change in the government that they might be willing to make changes to legislation to create new ways to get documents?
Yeah, I see. I see that the willingness is there, because they've been pushed by the civil society, and the willingness is there. But what I see as a major challenge is supporting the government becomes expensive, because there's so much civil society is trying to support them. They'll say the civil society should come and support us, but they would also want to be supported, including the allowance, including the whatever, so it becomes expensive to support them. So, but if they put it as the strategy that they want to do, and the willingness to say, this is what we want to do, this is how we are going to do it, as civil society to come and help us with ABCD, that actually getting into the system, into the communities, rather than to say, maybe if you want to help them with the decentralization, you'd find that maybe only 20% of the budget is going to the communities, and the 80% of the budget is going to other things. That's when the challenge becomes, and we start questioning the willingness. I know the government is willing to do this, and it's something that they've identified as issues. That's why they've been doing blitz into the communities to try and support the communities to get the identity document in different communities. But this system, I think, for it to work, it has to just be decentralized, so that wherever I am, because you find that I lost my identity document. I got robbed, and I lost my wallet, and I wanted to renew my identity document. Do you know what time I had to wake up to actually get my identity document? I had to wake up around 3 a.m. in the dark so that I'll be there by 5.
Huh.
And there was already a long queue.
Oh, good.
And I just waited in the long queue. And a guy came and said, we're only giving identity document to 60 people. And I think I was around 100 and something.
In the queue.
You guys, you can go, you can come back tomorrow. Imagine. But it's something that I cannot move around without. I cannot go anywhere without any identity document. So it becomes very challenging. It's only the advantage is that I've got my license, I've got my passport. Right now, I've resorted to using the license. But imagine if I didn't have a license, if I didn't have a passport, what will I be using now to get my money from the bank, to do other things, even when I'm, that kind of a thing. So I suppose the system it's centralized at one place. Imagine maybe I would have used like $50, $30 to wait in the queue, and I'm told to come back tomorrow. And I have to use another maybe $10, $15 to go back and come back tomorrow using the money. So it becomes to be a very challenging system. That's why I'm saying we should be advocating for decentralization of documentation so that at least we can access it within our community anytime I want. It doesn't have to be a blitz whereby they go into the community, they do mobile registration, because sometimes when they do mobile, maybe I'm not in the community, maybe I'm not sick, I'm not mobile, I'm not able to move. But there's a day that I'm able to move. I can just go to a center and get my ID document and go.
Gosh. Well, it sounds like there's potential for change. Do you think that there's going to be any breakthrough anytime soon?
I don't think so, because usually the major thing that will be there, they'll be citing resources. We don't have resources. We don't have resources. We want to do ABCD, but we don't have resources. So I don't think it will be something that can be done very soon.
At least there are organizations with staff like you who are out helping in the community wherever possible in the ways that you can, and even helping people get identity documents.
Yes.
Well, Tafadzwa, thank you so much for this conversation today. It's been really interesting to hear about some of the specifics, but I think it's just very interesting to hear about the way that all of society is affected, even with things like literacy, as a result of identity being a barrier. So I just wondered if you've got any other points that we might not have covered, any other areas that you'd like to mention about identity.
I think we've talked most about the things, but the only thing is that that I just wanted to emphasize is most of the NGOs that are working, I think they also need to find a way that they can design some of these things to identify those people that don't have identity documents, and draft what we can call maybe a referral pathway where they can assist in terms of drafting a referral pathway. If there's someone that doesn't have an identity document, we can refer them to somewhere, because there are other legal organizations that can also help. Like in Zimbabwe, for the Zwala, the WILSA, they can also help in terms of people getting identity document legally, even if there are issues that are legal issues that are concerning. So this is one thing I wanted to maybe for other civil society that are working in the communities to try and work together to come up with a referral pathway system that actually identify these people with not a documentation, and see how best they can be referred and where they can be referred and be assisted. That's what I just wanted to add on.
I see your point. So if you're working in terms of nutrition, then another NGO might be working with education, and you come across people without identity, rather than you or your different organizations trying to help that person get a document, you'd send them to another more specialized organization to help with identity.
Yes.
Well,
yes.
Maybe someone will listen to this podcast, and maybe they'll set that up with you.
Yes.
Fingers crossed. Fingers crossed. Well, thank you so much, and I'll keep in touch, and I look forward to hearing how things go in Zimbabwe and whether there's any changes coming soon for helping people get a legal identity.
Thank you very much, Frank. Thank you so much for the conversation. It was interesting.
Thank you.
That was Tafadzwa Mavudzi, Monitoring and Evaluation Specialist for the NGO Nutrition Action Zimbabwe, one of many organisations that ends up trying to help people get legal identity alongside doing their own work. To find out more about the UN's Sustainable Development Goal 16.9, to listen to more episodes, or get the full transcripts, go to the ID16.9 Podcast website at ID16.9.com and see if you think we're on track for legal identity for all by 2030.